short breathing practice for those of you who are trying to conceive, whether that be naturally or through IVF. Okay, because it's a stressful time. I know, I've been there. As you probably know, we ended up having to go through IVF, but prior to that we were trying to conceive naturally, and you know, it's stressful because you start to wonder why it's not happening, and it brings up all sorts of feelings around not being good enough and not being worthy and not getting your dreams coming true, and there being something wrong with you, and or something wrong with your partner, or maybe, you know, you start to question whether it's the right relationship. Actually, I never did do that, but I think it can bring up those questions. You know, so whatever we can do to calm ourselves down and stay kind of as balanced then as possible mentally and emotionally, actually, is really helpful. I mean, emotionally you could be all over the place, actually. That's the tricky bit, or the tricky thing. So anyway, I hope this might help in some way. Now I'm going to sit in Sukhasana because for me this is a comfortable cross-legged position. For some of you it will be totally uncomfortable. So you might kneel if that's helpful for you. You could sit up on a blanket or a cushion. You could actually sit in a chair or sit on a chair if you wanted to, or even with your legs out. But again, if you find that you're leaning back, you probably need to sit up on something. And I'm sorry I haven't got anything with me to actually demonstrate that, but I'm pretty sure you can prop a cushion under you without me necessarily needing to show you how. And then let's just bring our hands. So I'm going to just rest my hands on my thighs, but you could rest your hands in your lap if you wanted to. And then I'm going to close my eyes, and I invite you to close your eyes too. And let's just begin with a falling out breath. I'm fond of falling out breaths, so we'll take a breath in through the nose and out through the mouth. Okay, and then let's just settle into abdominal breath. So at this point, some of you might find it helpful to take your hands onto your belly, onto your tummy. Okay, but I'm just going to keep my hands on my legs for now. And I should say, actually, for this you can, if you want to, come to lie on your back. I just find it more effective if I'm seated. But do feel if you know, if this is really uncomfortable, lie on your back. But when you take a breath in through your nose, you're going to connect with your diaphragm, and your diaphragm is that dome-shaped muscle between your rib cage and your abdominal cavity. So this is sometimes called diaphragmatic breath. As you breathe in and connect with your diaphragm will move downwards in space, acting almost like a vacuum to bring the air into the lungs. And as it does so, it will cause your tummy to rise or expand outwards. Okay, so you're not using your tummy muscles per se, but really connecting with the diaphragm. So inhaling, diaphragm moves down, you find that the tummy expands. Exhaling, the diaphragm moves up in space and the tummy collects back in towards the spine. Sometimes it can feel uncomfortable, like if we spent a lifetime trying to keep our tummies pulled in because of issues around weight or, you know, appearance, and it's cultural, I think, as much as anything, then it can be tricky to let that go. And when we're trying to conceive, we have to be really honest about all the blocks, all our obstacles that we've put in our own way, all the thoughts that we try to not notice that we're thinking about. You know, any resistance then, I think, is what I'm trying to say to conceiving. Like, it's so subtle actually that we don't often notice that it's there. That's the problem. So any like insecurities we have about our ability to be a kind and generous and loving mother. You know, if we've had issues with our own mother, for example, that can show up. Any issues we may have around our body image, and, you know, the idea of getting bigger then when we're pregnant, that can also, you know, be a real like sticking point for some women. You know, any fears we have about not being good enough, about not feeling supported, that can show up as well. Okay, so we'll just let that go at the end of the exhalation. And then let's move the awareness up more so into the chest cavity and the heart space. So we might call this thoracic breath or intercostal breathing. And we're going to breathe in and out through the nose again. This time we're going to focus on trying to create more space within the rib cage itself by connecting with our intercostal muscles, the little muscles between our ribs. So it's not to say there won't still be some movement around your tummy, but more so that we focus on the rib cage, so in and out, breathing in and out. And a bit like I invited you on when we were trying abdominal breath, if you want to, you can take your hands onto your rib cage, just to feel the movement. So important to weed out any resistance that we might have, you know, to really go into ourselves, to notice like what's there on a deep level. Give voice to them, give voice to our insecurities and our worries and our concerns, because otherwise they just eat away at us. You know, if we've suffered loss previously, if we've suffered miscarriage or stillbirth or termination, then you know that can still play a role, like prevent us, like be a sticking point almost for us, because it you know it created a feeling of pain and sorrow and heartbreak. So we can be resistant on some deep level to going there again, even though we know that we want to conceive. You know, it's tricky, it's complex sometimes. Gentle to ourselves, always gentle to ourselves with the breath even. And then let's transition from here into directional breath. So as you breathe in, you continue to fill into your rib cage, but then explore expanding down towards your navel center like you did right at the beginning. And then on the exhalation, release from navel center before releasing up into rib cage. So you're filling from top to bottom and emptying from bottom to top, if you think of it like that. So breath comes in, expanding into rib cage, heart free, down towards navel center as if you're taking heart energy down to womb space. And then exhaling energy of womb space all the way back up to heart space. You're basically taking the love of the heart down to the womb space and the creative energy of the womb space back up to the heart. So you're bringing them in union, okay? Helping them to heal. Let's see if we can lengthen into the exhalation. So I'm going to bring a count in. I'm always a bit reticent to do that because I don't want you to become disturbed by the count that I've chosen, in so much as if it's a struggle for you to breathe to my count, then don't stay with my count, okay? Because I don't want you to create greater agitation for the mind. So stay with your own ratio instead, but just trying to make your exhalation longer than your inhalation. But I'm going to count 4 on the inhalation, 6 on the exhalation, okay? And if that feels comfortable for you, stay with it. But otherwise, like I say, just let it go. Stay with your own ratio. So let's release all breath from body. Complete exhalation. Inhaling, 2, 3, 4. Exhaling, 2, 3, 4, 5, 6. Inhaling, 2, 3, 4. Exhaling, 2, 3, 4, 5, 6. Inhaling, 2, 3, 4. Exhaling, 2, 3, 4, 5, 2, 3, 4, 5, 6. Inhaling, 2, 3, 4. Exhaling, 2, 3, 4, 5, 6. Just keep going now. Same breathing, same count, but maybe incorporating a yantra now, so visualization. So as you breathe in, you might imagine a light, it doesn't matter what colour light is, but a light moving from heart space down to womb space. And from exhalation, that light moving from womb space back up to heart space, but still lengthening into your exhalation. Take 2 more rounds. And then just let go of this breathing exercise and the yantra, counting. Notice how you're feeling. And then I thought we might just finish with some Brahmari breath, so the bumblebee breath. So by all means change your positioning of sitting if you need to. There's actually, you can take this position here where you bend your knees and bring your feet flat to the mat, and you can rest your upper arms on your knees possibly, and then close your eyes and rest your fingertips on your closed eyes and close your ears. You create this, I can't remember the name of the mudra actually, but it can be very helpful anyway, kind of really taking you into yourself and closing off from the rest of the world. And it's a very calming, nourishing, soothing, stress relieving breathing exercise. So anything you can do, so I mean, highly recommended. So let's take 5 rounds of breath here, and then we'll just sit for a moment. Okay, so you're going to breathe in through your nose and then hum like a bumblebee 5 times over. Just settling into this space within you that you've created through these breathing exercises. Just notice the calmness of the mind and the cooling as well. Maybe some of you feel the vibration in the body. I'm just going to leave you here, so you might just continue sitting. Or you might come down to rest in Shavasana. Stay positive.